Now let's understand the various types of articulations that we have within the vertebral column. And the first type of joint or articulation you want to understand is that exists between the articular processes, superior to inferior. And these are referred to as zygapophyseal articulations or joints. And if we take a look here, we have 1, 2, 3, 4, 5 vertebrae represented. We see costal facets here on the bodies of these vertebrae. So these are thoracic. And then we get down to this level, we no longer see costal facets. So we know that we're looking at lumbar vertebra 1 and 2. But what we want to focus in on is this area here, or here, for example. Here we have the inferior articular process of this vertebra above, and then the vertebra below here has its superior articular process, and then as a result, we form this type of joint. There are segmental differences in the orientation of the zygapophyseal joints that will confer different ranges of motion from one segment to another. So if we look at the cervical region, the orientation of these articulations would be somewhat oblique in nature, allowing for conferring greater range of motion. Within the thoracic area, the orientation of these joints is more in an anterior posterior direction. That will help to limit to some degree the range of motion. In addition, at the thoracic level, we have superimposed here the ribs, and that will further restrict the range of motion. And then within the lumbar segment, the greatest restriction in movements imposed because of the more lateral orientation of these particular articulations. This particular slide is demonstrating a type of joint referred to as a symphysis. The plural of that is symphyses. In simply, an anatomic symphysis is shown in through here. This is a fibrocartilaginous joint. So this type of joint is found between our vertebral bodies, and the structural component of this type of joint is going to be the intervertebral disc. This region here represents the intervertebral disc with a vertebral body above, vertebral body below. 24 of these are present within the vertebral column. You do not have one between C1 and C2, nor do you have intervertebral discs arranged within the sacral region nor the coccygeal region. So you'll have 24. An intervertebral disc has an outer ring called the annulus fibrosus, and the tissue that constitutes the annulus fibrosus is fibrocartilage. And then the central component, which is kind of hard to really demonstrate here, becomes less distinct as one ages. And the more central gelatinous component of an intervertebral disc would represent the nucleus pulposus, which is a remnant of the notochord. There are also M plates here on the inferior aspect of the superior vertebral body and on the superior aspect of the inferior vertebral body, and these M plates are composed of hyaline as well as fibrocartilage.